Rejuve Medical's physical therapy team here. And what I love about this group is not only getting to hang out with them every day, but seeing all of them excel as clinicians and grow as human beings. I know it's kind of cheesy, sorry guys. But watching them grow up and mature somewhat. But I just want everyone to somewhat. I want everyone just to introduce yourselves, let people know how long you've been practicing, how long you've been at Rejuve, and then we'll go from there.
I'll start then.
Okay, thank you.
Hi everyone, my name is Jake Kukowski. I started at Rejuve 8 months ago. I am a physical therapist. I graduated December of 2020. Right after PT school, I actually did traveling physical therapy for about 2 years. Traveled the country from East Coast to West Coast, just picking up jobs, seeing different things each state offered. From there, I actually went on to residency school, where I completed a sports physical therapy residency at the University of North Dakota, and immediately after that, came to the Rejuve family.
Where was your favorite travel location?
California.
Why do you like California?
Because I got because of Napa. I lived in Napa Valley, California with my now wife, and all we basically did was I worked as a physical therapist and drank wine. That was
That's better.
Responsibly drank wine.
There we go.
That's the key word.
Final answer.
Yeah, final answer. Yeah. So no, a lot of good experiences out in California, and both for personal and professional life. So it was a great time, and I'm glad to be back in Minnesota though. So it's good short stay. That's about it.
Good place to visit.
Yeah, good place to visit as well. That is very true.
I'm Brittany Bragelman. I have been a PT for 15 years.
As long as Vegas is
For 15 years, I think. I've been at Rejuve for 10 of those, and when I started, it was just me, and now I get all these wonderful people. So we've grown from a department of 1 to a department of 7, and it's been pretty cool to see that, like I said, pretty cool to see that progress.
I'm Alex Hohenstein. I graduated last May, so I'm kind of the
fresh meat.
yeah. And I started working here right after.
Respectfully.
Yeah. I was here on a clinical rotation my first year of PT school back when I didn't know anything. So Brett luckily hired me back. I'm still not sure why, but
We tricked them into coming back.
Yeah, so I'm the new kid on the block, but love it here so far. I love coworkers, all patients. It's been awesome so far.
I am Angie Jokey, and I'm a physical therapist assistant. I've been here for 10 years. When I first started, it was just Britt and I, and we have seen a lot happen with the Rejuve PT department, and I would say we are running at our smoothest at this point in time. I got into PT after having some surgeries myself, and then it just kind of went from there. I have never had the desire to be a PT because I don't want to be in charge. I like to be number one in command, so don't ask me too hard questions because I don't know the answer. That's it.
That's good. Yeah, that's good. I'm Maggie Bentley, and I'm a physical therapist assistant. I'm originally from Nebraska, and then graduated school there, and then moved here and started at Rejuve. So I've been here for close to 3 years at this point, and I've been dealing with these hooligans ever since. So,
Can you say Nebraska without laughing?
no, because I know I was just waiting for everyone to be like, Nebraska, me, I'm from here.
Do you like corn mix?
Yeah, it's really great.
I do like corn.
Let's go.
It's really good, those hooligans that I work with, you know, not to know.
That's getting better. Getting better.
Get better, yeah. I'm Nick Whitrock. I'm a physical therapist assistant. Been here for Rejuve for 6 years now. I did work at another clinic for a short time before I came here, and then I'm also currently in a transition program from PTA to DPT out in Ohio. So Thank you. So you might not see me as quite as often anymore. I'm here every other weekend. I'm out in Ohio, but I'm trying to be here as much as I can for my patients and my coworkers. So
That's all.
Amen.
Now what else do you want?
How we got into it?
Oh, how we got into Angie,
Sorry, I
listen.
said that. Yeah.
Well, you didn't go into deeply.
You just said
How
after having
deep?
surgeries, how do you want me to go?
What kind of
What
surgery?
kind of surgery?
I had 2 shoulder surgeries. My first one was a labral repair at 14. I was a butterflyer in swimming. And then my second one was when I was 16 and just clean it out. I ended up with frozen shoulders, so they broke up a lot of the adhesions in there. And now here I am.
How's your shoulder now?
We don't talk about it.
Shall we show it exhibit A and B?
What do you mean? I do great.
Let's
Let's
see
do
that
that.
side.
You mean this one?
It's like you need PT or something.
Weird. Do you guys know any good ones?
I know a couple.
Do you?
Yeah.
Oh,
2.
Pick me.
Which one's the one that's not?
You guys can guess.
well, she doesn't remember me as a student, so I'm not about
You were a student here?
Yeah, I guess.
Yeah, Brittany.
Britt forgot
It's
too.
not her favorite.
I
No.
also
He
one
was
and only
supposed to be
PTA
mine.
student.
Yeah, and she's never taken a PTA student again.
When you're that good.
When you're that good,
You're
why
Nick.
go more?
When you're good, you're Nick.
You're
Honestly.
good, you're Nick.
Yeah.
I mean, seriously.
Hot dang.
Hot.
Britt, why'd you get into PT?
So I think a lot of you guys got into PT because of injuries. That was not the case for me. I had my own injuries, but never really had PT. So I kind of feel like I'm in the minority when it comes to that question. But basically, I knew that I wanted to be in a profession where I got to help people, and I wanted it to be with something active. So when I was graduating high school, I either wanted to be an orthopedic surgeon, an athletic trainer, or a PT. I didn't want to be a surgeon because the patient is out cold the majority of the time, and I like to talk. I like people. I liked athletic training, but decided that wasn't for me because of nights and weekends. I wanted a typical during the day, and then I get to be home with my family. That's important to me. So then I decided to become a PT, where I get to do exercises with folks and help them with their pain and get to talk with them and ask them questions of the day and find out their deepest, darkest secrets.
All the tea.
All
in
the
their
tea.
families.
Spill it.
Which is covered by HIPAA, which is perfect.
Exactly.
So you can just tell us and it never.
And it never gets out.
No.
We may have glass windows here, but
They're frosted over.
We have brick walls.
Yeah.
Ooh, that could almost be a
No.
So okay,
No.
come to PT.
we have glass.
We have glass windows, but they're more like brick.
walls. How about you guys? I know you guys had some injuries.
Yep.
Take some photos.
You know what I mean? I got into PT because I originally was in a PT program and physician's assistant program. And I at one point actually was leaning more towards physician's assistant because I wanted more of the medical knowledge. But my sophomore year of college, I ended up getting injured during a lacrosse game where I tore my ACL and both menisci. So it was a pretty down moment because a lot of stuff, both school-wise and personal-wise, was going on. But I went to physical therapy and actually saw a sports physical therapist when I was out of school, and it really kind of changed my life on how I viewed recovery, how I viewed pain. I never really thought I was going to play lacrosse again, and so I kind of continued on. And then my school called and said, "Hey, you got to choose a path." So I pretty much dismissed going and becoming a PA and decided to go into PT. And from there, I learned a lot from my own sports physical therapist, and I actually became a PT tech. So I worked a lot at their clinic, learning the roles of a PT, learning the roles of a PTA, learning the roles of a PT tech. I got into PT school, continued on, and then I actually wanted to just basically help athletes get back to where they want to be. And with sports being my main area of expertise, it allows me to have a personal moment with them too, because a lot of times they come off their sport where they're not playing, they're not with their friends, they're not doing anything active, and they're not used to being that, honestly, that lazy at points in times. So it's easy to kind of connect with them and understand that right now it looks really bad and there's not a lot of positive things going on. But wait till you're about 3 months out when you're finally jogging, or you're finally throwing the ball, or you're doing anything that makes you feel more active. Then your next challenge is going to be, okay, I'm glad I'm here, but time to get to the next step. So that's really what PT means to me and being a physical therapist. So
And Brittany has her sports certified specialist from her residency, and Jake is doing his right now, and he takes his test when?
14 days.
You got it.
He's not counting.
So much, it's so much fun. I love it. We're great. We're not stressed. We don't.
You're fine.
We
You're
get
fine.
plenty of sleep.
Yeah, we're doing well.
Probably just as much as you at this point.
Yeah.
With driving.
Driving or surviving?
Yeah.
Which
one?
They kind of blend together.
All the days are ending in Y, so that's it. Who cares at this point?
What was your injury?
In high school, I tore my hamstring. Playoffs my senior year of football, tore it, and then I went to PT for a little bit, got a lot better, and then a month later, 2 months, I tore it again. And then I was in PT. That one was a lot worse, so I was in PT for a long time. I was there every day that I could be, and I had an awesome therapist that helped me get back to where I wanted to be. I ended up getting back for state basketball, that was my goal from the beginning. And I was like, I kind of like this gig here, so I was like, maybe I'll do that. And then when I was following that path, and then I realized that there's also pediatrics physical therapy. My mom is a speech pathologist. She works at Buffalo with elementary age kids, and then my oldest sister is a special education teacher. My youngest sister is an elementary education teacher, and my mom said I should always be a teacher too. And this
Fair
was always kind of I ended up finding a link between pediatrics and physical therapy, so that really sparked my interest. And right now I'm at an ortho place, obviously, but working on some things, possibly bring some pediatric patients here. So
Younger generations.
yeah.
What type of things do you focus on compared to, we obviously see everyone from age 2 to 100, but what makes pediatric PT a little different?
A lot of times, so at my last rotation, clinical rotation, I worked a pediatric clinic. It's a lot more neuro involved patients, so developmental stuff, milestones, things like that. So it's a little bit different than ortho. But then, just like every other kid too, so it overlaps a little bit with ortho. Doing things, throwing a ball, kicking a ball, running around, all things like that. So.
And Ange, you had a pediatric rotation too, didn't you?
I did have a pediatric rotation, and it's always been something I wanted to get back into. I know when I interviewed with Britt a really long time ago, she asked me, what would your dream job be? And I said a pediatric orthopedic clinic. So like the young athletes, 5, 6, 7, 8, 9, 10, that like sprained their ankle or fell off the monkey bars or whatever. You just get to make it up, and it seems like you're playing the whole time, but you're not actually playing.
Yeah.
There's a reason for everything you're doing, and you get to use your creative brain a lot more, which I think is super fun. We do that with everybody here anyways, but with kids, it's like making it a game. I like that. It's fun.
We went on a tangent for a while, sorry guys. Make
Yeah,
sure,
keep going, keep going.
What got you guys into PT?
Why do PT, guys?
I originally broke my ankle and had to have surgery playing softball when I was pretty young. And I had a great relationship with my therapist, my physical therapist at the time, and that kind of is what started that. But it evolved as when I kind of got out of sports and went into our different hobby. And that it still evolved because I worked in a nursing home growing up in high school and really enjoyed those relationships that I made with the older patients. So I do really like our sports therapists or our sports kids and all the things, but I actually very much enjoy our older generations here too, and like creating those relationships and getting them to feel better and play with the grandkids and do all the things. So it's evolved as I've gotten older, but that's originally how I started doing physical therapy.
And hearing their stories.
Yeah, Maggie's really good at hearing their fun stories that we get.
So cool.
That's good thing.
Mine's pretty similar to kind of like what Brittany was saying. A lot of times it seems like it was a sports injury first. So I have a couple reasons why I became PT. But one big thing was Mom kept saying, if you're going to keep hurting yourself, you better learn how to fix yourself. So a lot of different.
Carla.
Oh, she's right.
She's right.
You're still working on
She's the right
that.
lady. So a lot of different sports injuries between football and basketball. So it's a rehab there. But then also I grew up in a household that my grandpa and I had some other aunts and uncles who were in healthcare field. And with team sports, I very much saw how it overlapped between healthcare and team sports and how you were developing a team environment to accomplish a common goal. And that was a very attractive thing for me to kind of pursue this career. So, Alex.
How did you get hurt if you were on the bench the whole time? I too would like to be.
And the mic is off. That's good.
Oh.
You can't teach these young kids anything else. All respect.
As a kid and now we're young.
Yeah, that's
Yeah,
right.
you guys are the babies.
Because we're not in our
I
30s
got
yet.
10 years on Alex.
Was it 10 years?
Almost.
Oh my gosh.
God, you're old. I don't know where all that gray hair came from.
Yeah,
Okay, thanks.
I was
You
originally
just
with my
want me-
wife and my kiddo, but I think some of it's from my coworkers.
Just
You're
us.
welcome.
So why transition now from PTA to PT? What was the step?
Yeah, that's a
What
great
was the-
question. I've always wanted it. I always wanted to become a DPT. It just, for some reason, didn't lie in the cards. I originally started my undergrad in pre-physical therapy, but I very much, basketball was just always on my mind, and I spent way too much time in the gym versus, studying. So the PTA round came first. Just it worked better for my schedule and what I was doing at the time. And now, getting a little bit my feet wet, working here for 6 years and kind of seeing what Rejuve has to offer, how stem cell PRP procedures keep growing. I feel like the PT profession still has a lot to grow and continue to go. And I think I definitely want to be part of that. And it was now or never. So I had a very good support system. Brittany has been huge for me. Rejuve has been huge for me, my wife, my family. So
Your coworkers, we get gray hair just when you go to school. We have to help you.
my
All
coworkers
your
help me.
technology,
We're all learning.
We're all learning at a time, So, but no, I'm very excited. I'm very happy that we're making it work, even though with a newborn child, and it's not the best. It's not the easiest time right now, but we're making it work.
What's really cool about Nick going back and him being here for so long is a lot of our patients know all of us, but they've come back and they've seen us multiple times, and Nick is really good at making relationships with his patients. So now they're watching him go back to school and like, how's it going? How you doing? Knowing that he has a new family. And so just to see the patients be equally as excited for him as we are makes just a point that Rejuve PT is extra fun like that. We're just a big happy family.
And I think, so hearing all you guys talk about that, like that's the theme, like we are a family as coworkers.
Mm-hmm.
Our patients are our family, and hearing you guys talk about going through an injury and having that PT or that therapist like be your person, and like they motivated you, and to be able to do that for someone else, and have that relationship goes both ways. Like you guys found it rewarding as student athletes, and then now we get to find it rewarding as the therapist too. So it's really cool how, yes, we're physical therapy, but it's that personal relationship that I think keeps us coming back every day, whether it's that relationship with each other, with our patients, with our other
Yeah.
coworkers. So they joke about, you know, like, you guys are my therapist, but yeah, you know.
Kind of.
It ends up being that way, and I don't mind it, it's cool.
You spend 45 minutes with somebody 1 to 2 times a week, you
It's not
learn a
very
lot
good.
about them, and it's fun learning about their life and why they're here and how they're doing, and you kind of get to learn their family and what they did the weekend before, so the next time they come in, you get to ask them, and then I think the patients like that because we remember and they feel like they're just they're a person to us, not just a number on our schedule.
It's almost sad when they leave.
Yeah,
Sometimes
We
it
all
is,
get
yeah.
sad.
Yeah.
there's been tears from patients,
Yeah.
for sure, when they're, I think, overwhelmed with how much progress they've made. Progress, did I say it like a Canadian?
More like Maggie.
Progress? Progress.
I don't know, I said that word either.
But yeah, I think that's pretty cool that,
Yeah.
that we get to do that for people.
Favorite patient story? Favorite patient story? This one's come up a lot actually for me. We have this one particular patient, and they have come back to us multiple times for multiple different things. Well known in the clinic, both in PT and clinic. Big supporter of Rejuve, but one of her first times here, I was newer. She had no idea what PT was about. And we were in our old space, and I wanted her to do just a step up onto like a 4-inch steps to practice like stepping up onto a curb. And she kept telling me, I can't do it. No, I'm not doing that. She flat out told me, yeah, no, I'm not doing that, Andrew. I said, no, but you're going to, so let's just try it. And the first time she did it, she cried tears of joy. She's like, I never thought I would be able to do this again. And I was like, but look at you, you're doing it. And so now she still teases us and she'll say, no, I'm not doing that. And we'll be like, well, you're going to. And she's done everything we've asked her to do. So it's fun to watch her move on and like, you can do it and you will do it. You just have to get in that right mindset.
I think my favorite one since being here is I think it was you and I, Britt, that treated this patient. And she came in with 10 out of 10 pain, couldn't move off of the bed, couldn't do anything. We couldn't do anything. But her main goal was to dance at her son's wedding.
Oh, yeah.
And so it turned out to be this whole long thing, and there was an infection, and that ended up getting under control, and we were able to quickly, actually, the wedding was coming up. Each week she'd be coming, and the wedding would be coming closer, but she was able to go and dance and stand most of the night and have that cherished memory. And then she came in that next week and she showed us pictures and we all cried. Like, it was just
So
the coolest thing. And even though it was so small, maybe it was small to us, like, because that was just a small goal, but that was so huge to her and a huge thing for her to be able to make that milestone. That was probably my favorite one so far. I mean, we have great success stories every week, but that was a big thing for her. Any good ones?
Nick, you've had some good.
I don't know.
Yeah,
a lot of good ones.
Talk about your young basketball athlete.
They got to hold Archie.
Yeah.
I do know who you're talking about.
Yeah.
Just was following along.
Well, I
Love her.
I don't know what to share on that.
Yeah.
I just don't. I don't know.
So why'd she come in the first place?
I had a patient who tore her ACL right before the basketball season. We've treated that individual before, so we built some great patient rapport. She was working out in our hardcore program that we offer during the summer to our athletes. So she's doing very well. It's just one of those fluke incidents, non-contact, and ended up tearing her ACL. So she missed that season, but we were able to rehab her back that she could compete her senior year. Unfortunately, the other knee ended up, again, a non-contact injury. The other knee tore her ACL. So we had a lot of rehab over the last couple of years with her, but she's now in college and making us proud and playing basketball, and it sounds like she might be getting into healthcare studies, so it's very cool that, just like Brittany pointed out, these two mentioned, you build that positive rapport with your provider, and maybe we made a difference that for the positive that she ultimately could show us healthcare, but it's pretty cool to kind of keep in touch and know how she's doing. So.
guys have any great stories?
Any athlete can back, had a ton of success with just sports and everything like that, and just getting just different athletes back. So pretty much anytime an athlete's step back on the field, back on the court, anytime like that, throws a pitch, anything, it's pretty satisfying to see them finally ramp up and see everything. I know one that we've all been involved with, which isn't sports, which obviously isn't the path that I'm usually taking, but we had a patient that came in with a failed knee replacement or failed PT after she failed PT going to a different clinic, so she came in here and just like Angie's story, it was one of those moments where she finally started seeing success and progress and would always have these doubts of like, I can't do that, I won't do that. And it's that mental barrier that she was finally getting over and the physical barriers that she was finally getting over. And she eventually, unfortunately I wasn't here for it, but she eventually started using the stairs, which is she never thought she'd be able to use.
We've had them like 5 years.
Yeah, and she'd always be nervous to do it and stuff, and hearing that was very, very, very emotional because it's sometimes it's not just about getting back to the game, it's about getting back to life.
Yeah.
Our patients come in and they're coming to us because they have something going on that they can't do anymore, whether it's hold their kids, dance with their son, play basketball, or simply go up a curb. That's the reason that we come back and do our jobs every day, and why we listen to everybody and help everybody, because we know sometimes it seems like a small goal to us, it's a very, very large goal to them. So
I had, this was before I was even a student in PT school. I was doing a job shadow at a pediatric clinic, and there was a young girl who had spastic cerebral palsy, and they have this program where I think it's an hour a day, 5 days a week for like a month. It's a really intense program of her working on trying to get her to walk. And then on the last day for her discharge, it was her mom and her dad, and her mom was about 10 feet away from her and was playing her favorite song, and her mom and her dad were kind of coaxing her over, and she walked for the first time in her life.
I just
She
got
was-
goosebumps.
I love
like
that.
3 years old. It was got people crying on camera.
Yeah,
It
that's
was one of the coolest things I've ever seen in my life. So yeah, that was a good one. I wasn't even a PT then. I was just still undergrad.
But to see how big of an impact that PT can make for people.
Yeah.
Pretty cool.
You're almost like a dinosaur, so how many patients have you had?
Yeah, Mother Goose.
I gotta move you guys. I'm very experienced. I've seen,
That's a good way of putting
I've
it.
seen a lot of patients. It's really hard to choose. He can't do it. It's very hard to choose. There's so many cool stories that I could tell. I think is thinking about not taking anything for granted. So we treated this very high level dancer. She had injured her knee. She had surgery. She had no idea what PT was about. But I think it's an example of how you have to tailor your treatment to every patient, regardless of what they're here for. So whether they're dancing, whether they're getting on the curb, whether they're walking for the first time. And by high level dancer, I mean like insane things
She's so good.
you do with your body. And the first day that we finally got back to doing turns, and her first turn, so a single, when she's used to doing quads and all like turn sequences and things like that, she did one turn and jumped up and screamed and cried, and her mom was there and she cried, and like it's such a simple skill for her, but to do it for that first time in 5 months, like that was pretty cool. And yeah, we did get her back to doing everything else, but just those little milestone moments, or someone that injured their shoulder that was able to reach up into the cabinet or dress themselves.
Dress, so that's always a big one.
Like it's just it's pretty cool to be able to experience that alongside people.
And you also, you make an impact on their life that she actually is going to school now for PT.
Yeah.
And like spent a lot of time with you and got to learn all the ins and outs, and that's it made an impact other than
Yeah.
just her knee and her injury.
So although the turn in that day for her was special, the day that she told me that she changed her mind and was gonna be a PT, like that made me wanna cry. I was like, oh my gosh, yes.
You go get the tissues.
It's been fun, well, specifically this patient with Brittany, like she's treated dancers before, but this one she just had that special connection with, and Maggie and I were both dancers, and so just teaching Britt like dance words and like how can she properly PT transition this patient into this dance move, so then Brittany's learning at the same time, and just to watch everybody continue to learn and grow with all of our knowledge, because we're all knowledgeable about different stuff. At one point in time, Brittany thought an Alice cone, which is a type of turn, was called an ice cream cone. So we're doing well.
They knew what I meant.
They did know what
So
you meant.
can teach it all.
You can teach an old dog new tricks.
You just let out, just roast you right here, and like you're the number one here, like in charge of all of us. You just
Whatever
Just
makes you
what-
guys happy makes me
Aw.
happy.
thanks, mother.
yes.
That's what helps.
Other moves.
They're treading lightly right now.
Yeah, I'm waiting for Nick to say something because normally he's the one that's like poking fun, and I'm like, he's kind of quiet
He
today.
smirked. He was looking down and smirking. He was on.
Inside thoughts.
The nicest guy in PT, what can I say?
Mm,
Oh.
Oh,
yeah.
okay.
Halo.
I'm just the eye candy here. What's up? I'm just the eye candy.
Makes it a little less when you say it yourself.
Yeah.
One of us says it.
Sure, Alex, that's why we keep you around.
Yeah.
I'm here for it.
Well, that's why
You say that because Dr.
Awesome.
Cupcake?
Oh,
Dr.
It's
Cupcake.
me. No.
Okay.
I had a couple patients even today ask me about it.
Well, I just even still
What
see
do you
the
say?
name tag on your tray over there, so you know.
It's a good conversation starter.
You own it.
So I'm sweet.
Well,
We something.
we hope that you guys found some value in our candid talk, and we appreciate you spending the time listening to it all, if you have, or if you just fast forward to the end. But I just know I'm grateful for working with these folks and being able to see people walk through that door every day and leave better than they were. It's a pretty darn cool thing to be able to do alongside these people. So
Yeah, come hang out. We're here all the time.
we kind of are.
Are you?
I am.
Oh.
You're on vacation. I'm just saying, I didn't know you took PTO off, but okay. Yeah.
All right.
Cut.
Good.
Cut.
Is that what you're looking for?
Yep.